Okay, in this chapter, we'll go over the reproductive system. First, we'll start off with the parts of the male reproductive system, then the female reproductive system, and we'll end this chapter and this lecture with the menstrual cycle. So there's a lot of information in this chapter. So you may have to watch this lecture more than once or review the notes several times because there's a lot going on here. First, we'll start with the introduction. The whole point of the reproductive system is to both produce and nurture the sex cells and then transport them to sites to be fertilized. For males, the sex cells are the sperm, and for females, the sex cells are the eggs. Another term for egg is the oocyte. Whenever you see the prefix oo, that's always a reference to egg. So egg or oocytes, same thing. Now both male or female sex cells have one set of genetic instructions on 23 chromosomes. It's produced by a special type of cell division called meiosis. So for most of the cells in your body, they go through mitosis, but for sex cells, they go through meiosis. So hopefully you recall that a normal human cell should have 46 chromosomes. You get half from your mom, half from your dad. So that's why sex cells should normally being keyword here, should only have 23 chromosomes. Alright, we'll start here at the male reproductive system. The primary sex organs for the males are the testes. Testes is plural, testis is singular. And another term for the primary sex organ is the gonad. And gonad is a generic term. It's not particular for just male or female. The term gonad just means the primary sex organ. So for males, the gonad are the testes. And everything else in the male will be considered an accessory. It doesn't matter if it's internal or external. You have the testes, which are the gonads, and then everything else, no matter what it does, will be considered an accessory. And of course, within these testes, you'll find the sperm cells, or also called spermatozoa, and also various male hormones. Alright, here's a profile view of a male facing to his right. Of course, you have the penis here, testis here. We'll talk about what these structures are. The vas deferens wrapping around the urinary bladder. Up on top, you see these two tubes. These are the ureters coming from the kidneys, going down to the urinary bladder. And we'll talk a lot about most of these structures, but not all. Right, the testes are suspended by what's called the spermatic cord, and they will sit in the sac-like fleshy tissue called the scrotum. And as the testes descend, as the male fetus is developing, they will travel down what's called the inguinal canal. And after they descend, the spermatic cord will contain structures known as the nerves, the blood vessels, and the vas deferens. So the spermatic cord holds a lot of material. All right, here's a kind of a timeline between a 3-month fetus, a 7th-month fetus, and a newborn male. The testes start off actually in the abdominal canal or abdominal cavity and will migrate down to the pelvic cavity, and then they'll migrate outside of the body. So they travel through what's called the inguinal canal or inguinal canal. Okay, next we'll talk about the structure of the testis. Each testis is divided into roughly 250 or so compartments, and they're called lobules. And inside of each lobule, you'll find a very, very highly coiled tube called the seminiferous tubules. And these tubules are lined with a very special epithelial lining, and they'll contain the spermatogenic cells. And this is where you'll get the sperm cells actually made. The sperm cells themselves are created in these seminiferous tubules. All right. The cells that lie in between these tubules are called interstitial cells, but their formal name are the cells of Leydig. And these cells of Leydig will produce male hormones like testosterone to help those sperm cells mature and develop. Okay, here's a sagittal section of one testis. All these are seminiferous tubules. That's one lobule here, and so on. And you see inside, the sperm cells are being created, and as they're being made, as they get more and more developed, they move toward the outside, and they will move this way, and they will travel up through here, and they'll actually mature here in the epididymis. Here's a real electron microscope image of one. You can see, if you look closely, the tails of the sperm cells here, and these little dark circles are the heads of the sperm cells. And the cells in between these tubules are the cells of Leydig. So here's that image a lot closer up. You actually see the tails and the flagella, going inward, and all the heads of these sperm cells being made. And this is just one tubule of the 250 or so in each testis. Alright, spermiogenesis is the creation of sperm cells, or the actual maturation of sperm cells. And a normal sperm cell will have four parts to it. You have the head, which is where you'll find the nucleus and the 23 chromosomes. On top of the head is called a little structure called the acrosome. This is looks almost like a little hat sitting on the head, and in here you'll find the digestive enzymes that will help the sperm cell penetrate the egg cell during fertilization. Then you have the midpiece, which is where you'll find a lot of mitochondria to give it the energy to swim, and the structure that helps it move forward and propel itself as the tail, is where you'll find microtubules. Okay, here's an illustration of this. The head being right here, where you find a nucleus. The little hat is on top, acrosome. This is how the sperm is able to penetrate the egg for fertilization. If that's not here, then the sperm is just going to be bumping its head against the wall. It won't be able to penetrate the egg. The midpiece, where you find all the mitochondria to supply its energy and to help whip around this tail to help it propel forward. Alright, that's the illustration. And these are real images, even though it looks kind of like a drawing, but these are real sperm cells. Acrosome, the head, and tails of several. And of course, not all cells are perfectly formed. Some are going to be stronger, and some are going to be weaker. So some you can tell here, that's not really developed like it should be. It's kind of indented here. That's probably not going to go all that far. Alright, the epididymis. This is a very tightly coiled tube that's found on the top of each testis. And this is where these sperm cells go to mature. Immature sperm cells are not motile. They aren't able to swim on their own, but only mature sperm cells can. And I mentioned how tightly coiled they are. Each one is about 6 meters long. That's over 19 feet. So 19 feet of coiled tube is found on the top of each testis. So when we go back to this image here, this is epididymis. All that is about 19.5 feet on each side. That's where sperm have to go to mature. Alright, here's an epididymis in cross section. If you look closely, you can see the tails of the sperm cells here as they are maturing. Alright, I'll move on to the vas deferens. This is also called the ductus deferens. This is a muscular tubes that are about 45 centimeters long, and they will extend from the epididymis to the ejaculatory duct. And this is the structure that is cut during a vasectomy. That's why it's called a vasectomy, because you're cutting the vas deferens. And here's how that procedure works. As the normal male before the procedure, here's after, and here's a close-up. And all you're doing for a vasectomy is you are pulling out the vas deferens and basically cutting it off, and then tying off these ends, either by basically almost like twist ties you would find on loaves of bread, or you're cauterizing each end with fire, basically burning off these edges. If these edges are separate like this, sperm cells can't get from the testis out through the vas deferens and out to the body. And nothing will change with the volume of each ejaculation. Nothing changes for the male. The only thing that's not there are the sperm cells, which are the key component to getting a woman pregnant. So, but something to remember, if this isn't done correctly, If these aren't tied off correctly or these ends aren't cauterized fully, these ends can grow back together. So even a vasectomy is not 100% a form of birth control. It doesn't happen all that often, but it is possible for these ends to grow back together. So it's important that the surgery is done properly to be effective. All right, next we'll move on to the seminal vesicles. There's going to be two, one on either side of the penis. Each one is attached to the vas deferens near the base of the urinary bladder. And their function is to secrete fructose, which is a sugar. Remember, if it ends in "ose," it's going to be a sugar, or carbohydrate. And this will provide sperm cells with energy so they're able to swim. And these vesicles also secrete prostaglandins, which help stimulate the muscle contractions of the vagina and uterus to help hold in the ejaculate from the male. And the seminal vesicles will also empty into the ejaculatory duct. And I'll show you where those are in a second. Next is the prostate gland. This will secrete a very thin alkaline fluid that will enhance sperm mobility. It helps the sperm move more efficiently. And the reason why this is alkaline, as fluid is alkaline, is to help protect these sperm cells, because where they mature in the epididymis is a little bit more acidic than what is safe, and where they're going to end up in the vagina is also very acidic of an environment. So the prostate gland will make a fluid that's very alkaline to help neutralize and to act as a buffer to protect these sperm cells so they can survive longer. And the ducts of these glands will open into the urethra. Next one here, Cowper's glands are also called bulbourethral glands. These are just below the prostate gland, and these will secrete a fluid that's very similar to mucus that is secreted in response to the male being stimulated sexually, and will help to lubricate the end of the penis for intercourse. Okay. Here's a view of the posterior view of a male. You have testis here, epididymis here, which leads to the vas deferens that goes up and loops all the way around the urinary bladder. And on either side, you have the seminal vesicles here, and then the prostate here. And what's common for males, especially over 40 or 45, if you have prostate issues, it's probably going to be first symptomatic by having to go to the bathroom a lot, or feel like you have to go to the bathroom a lot. Because if the prostate will swell, it will push on the urinary bladder just above it. So that's a good indicator that you may have some prostate issues. All right, semen. A lot of people will confuse semen with sperm and use those terms interchangeably, and they're not the same thing at all. Semen is all the fluid that is ejaculated out of the penis. So this includes not only the sperm cells, but also the secretions of the seminal vesicles, the prostate, and the bulbourethral glands. So it's everything that comes out during ejaculation is the semen. So not just the sperm cells, but all the fluid collectively, all that together. Of course, the volume of ejaculation and number of sperm cells will vary greatly by male, both by general health and by general age. Volume could be anywhere between 2 and 5 milliliters and have anywhere between 40 million and 600 million sperm cells. And the reason why this number is so high, most of these won't get anywhere near the egg to even have a chance for fertilization. Even if you're making, say a low number here, let's say just 100 million sperm cells, you may only get 100 or 200 at the most, making it all the way to the egg to even have a chance for fertilization. So that's why males have to make so many, because so many will die along the way. Alright, now we'll talk about the external accessory organs, the scrotum. I mentioned this earlier, the pouch of skin and subcutaneous tissue that's divided into 2 chambers, each one housing a testis and an epididymis. And this is where you also find the dartos muscle. This is a smooth muscle that will contract and relax in response to changes in temperature. The testes have to be kept at a certain temperature to keep the sperm cells alive. If they get too hot, they will kill the sperm. If they get too cold, then they will be damaged. So that's why the testes are able to go up and down, depending on temperature. When it gets too cold out, they will contract and pull the testes closer toward the body to get warmed up. If the body is too hot, they will descend and relax to get further away from that heat. Of course, the penis. This will convey both urine and semen for males. It's made up of a very specialized column of or three columns of erectile tissue. The end of the penis, or the head of the penis, is the glans penis. This is also covered by the foreskin, and the technical name of the foreskin is the prepuce, and this is the material that is removed during a circumcision. Here's an illustration of all that. The skin going over the head of the penis, the glans penis, would be the prepuce. That's what's cut off during circumcision. And if you were to cut a penis in cross-section, these are the three erectile tissue columns. Right. And here, this chart is taken from the book itself, with all the structures that we talked about and their functions. So this would be good to look at for making flashcards. If you didn't want to go back and look over all the notes, page by page, a lot of good information all right. All right, all that was the male. So now we'll talk about the female reproductive system, and then we'll move on to the menstrual cycle. Of course, the female reproductive organs are specialized to produce the egg or the oocytes, provide a favorable environment for an offspring to develop, and to make sex hormones. Like we talked about with the male, the gonads are the term used to describe the primary sex organ, and for females, the gonad are the ovaries. Everything else that's used in the system are considered accessories. Doesn't matter if they're internal or external. So yeah, I have the ovaries, which are the key player here. Everything else is an accessory. It's like for males, the gonad are the testes. Everything else are considered accessories. It's like with the male, we had the profile view. Here's the same thing for the female. So you have the labia majora here, entering of the vagina here, the uterus here, that's just above the bladder. And as any pregnant woman will tell you, as baby gets bigger, you feel like you have to pee all the time. That's because it's sitting right on the bladder. So as baby gets bigger, you're going to push further and further down on the bladder. That's why you feel like you have to pee all the time. All right, now we'll talk about the ovaries. These are two solid oval structures that lie on either side of the lateral wall of the pelvis. They're held in place by several ligaments, but we'll talk about just three. The biggest one is called the broad ligament. This one will stretch all the way across from ovary to ovary. You have what's called the suspensory ligament, which holds the ovary on the upper end, almost like a chandelier being held from a ceiling. It actually is suspending the ovary from the top. And it's held in place also on the bottom by the ovarian ligament. So suspensory on top, suspending it, and ovarian on the bottom. Okay. Here's the broad ligament going from here all the way across to here. The suspensory on top, and on the bottom would be the uterine or ovarian. All right, the ovary is divided in two sections. These are terms that we've talked about already multiple times. The outer portion, which is the cortex, and medulla, which is in the more inner part or the middle part. The medulla is where you find loose connective tissue, lots of blood vessels, lymphatic vessels, and nerve fibers. But it's the cortex where you'll find very compact tissue and has a very granular appearance to it. This is where you'll find the follicles. So we'll spend more time talking about the cortex of the ovary. All right, just before a female is born, the female's eggs go through many stages of development. An immature egg is what's called a primary oocyte. Remember, OO is reference to egg. So a primary or beginning egg cell, primary oocyte. And each primary oocyte is surrounded by a layer of epithelial cells. So that combination together, the primary oocyte plus that ring of epithelial cells, that together is called the primordial follicle. So the primordial follicle is both the oocyte, primary oocyte, and the epithelial cells around it. Now, the development of these primary oocytes will basically stop right before the female is born, and it basically is put on pause until the woman goes through puberty, roughly 12, 13 years later. Now, when that female is born, she will already have all the eggs that you will ever have. So what you're born with is what you have. You can't do anything to enhance the number of eggs. So what you have is what you have. And to compare that to males, and we can keep making sperm cells far into our old age. We'll start around puberty, but we'll keep going basically until we die. Alright, next we'll talk about oogenesis, which is the process of egg cells in the female. Starting at puberty, some primary oocytes will continue division of sex cells, meiosis, and will continue with their development. Now, when a primary oocyte divides, the cytoplasm is not equally distributed. Normally, when you think of a cell dividing, you think, well, half of it goes here, the other half goes here. A nice even split. And that's not the case when we talk about primary oocytes. When this happens, you get a much larger cell called the large secondary oocyte, and a very, very small structure called the polar body. So instead of being even a 50-50 split, you have more of, say, 80-20. Okay? And this term is underlined for multiple reasons. The secondary oocyte is what will become the egg that is being able to be fertilized. The secondary oocyte is also what is being ejected out during ovulation. So this is what is probably the key player for fertilization and ovulation, the secondary oocyte. Now the secondary oocyte will undergo meiosis too if it is fertilized, resulting in a second polar body and the zygote, which is the fertilized egg. This is how we all start off, as the union of the sperm cell with the egg cell is the zygote, the fertilized egg, that one cell that every person starts off as. That's called the zygote. So after fertilization, this is what you have. You have one egg cell and 3 polar bodies. And these polar bodies will release some hormones, then will break down. So they are, for the most part, non-functional. So this is comparing meiosis 1 and 2 for males and females. And if you remember from meiosis, at the end you're going to have 4 daughter cells produced. So for males, you get 4 fully functional sperm cells. But for females, you get 1 egg and then 3 polar bodies. So not really a good return of energy when it comes to females anyway. Alright, here are pictures of how the secondary oocyte looks when it's dividing. You get the very small polar body and the oocyte here. So instead of being a nice even split, much larger cell here compared to here. This is as they're about to divide. So you can easily see the big size difference here. Alright, well, next we'll talk about the maturation of follicles. Okay, at puberty, the anterior pituitary gland will secrete FSH, a follicle stimulating hormone, which will cause the ovaries to get larger. And that's what the name means, a follicle stimulating hormone. Alright, during each reproductive cycle, some primordial follicles will mature into primary follicles and then into secondary follicles. And this full process to get a mature follicle takes anywhere between 10 to 14 days. At that point, it's called the graphene follicle. This is what will be involved with ovulation each month. So the graphene follicle. Here's how one looks. And we won't talk about some of these terms, so don't worry about the zona pellucida, don't worry about the theca interna or the antrum. But all of this here is a graphene follicle, and here's the secondary oocyte. This is what will be ejected out during ovulation, and this is what will be fertilized when a woman gets pregnant. Right, that leads us to the process of ovulation. This is when you are releasing the secondary oocyte from the follicle, and this is triggered by a very large increase, a very large spike of LH, luteinizing hormone, from the anterior pituitary. And this causes the follicle to swell fairly rapidly and the walls to get very weak. So think of filling a water balloon up with water. At some point, it's just going to get too much and it will just rupture. That's kind of what happens here. So the secondary oocyte is ejected out of the follicle towards the nearby fallopian tubes. And for the longest time, people thought that this process happened kind of like a cork coming out of a champagne bottle. It happened very, violently, very quickly, and actually it's almost the exact opposite. This whole process to being ejected out of the follicle takes about 15 minutes. And here's how it looks. This is from a real patient who volunteered for this, so I don't know why the S is here, but this structure is the follicle, and this, where the arrow is pointing, or where the cursor is on, is the secondary oocyte. What you see here is ovulation occurring, and going from inside here to being ejected out takes 10 to 15 minutes. So this is what will happen every month for a female during ovulation, and this is what will end up being fertilized and forming a new baby, is this right here. This is how it actually looks. And here's a diagram of kind of like a timeline of all this together. Primordial follicle here, getting more and more mature. This follicle here, and this right here, the follicle ejecting the oocyte, is this. The follicle ejecting the oocyte, that's that right here. And it's going toward the fallopian tubes, which we'll talk about in a few slides. And what's left over of the follicle will quickly break down after releasing a couple of hormones and will become non-functional fairly quickly. Alright, we'll talk about some of the internal reproductive organs for females. The fallopian tubes. These are also called oviducts or uterine tubes. Any of those three are correct, but for this class we'll focus on fallopian tubes. Now these will expand right near the ovary to form a funnel-like structure called the infundibulum. And on that you'll find finger-like extensions called fimbriae. Now these fimbriae will actually sweep in the ovulated oocyte into the fallopian tube. And inside the fallopian tube is where fertilization actually occurs. So if you go, this is a reference back to the image we just looked at, this oocyte being ovulated out or ejected out toward these little finger-like projections. And this is true on both sides of the uterus, not just one. But these little fingers will sweep in this into the funnel-like shape of the fallopian tubes, the infundibulum, and this oocyte will basically travel all the way through here. And if fertilization does happen, it will happen right about here. The sperm cells will come in through here, swim this way, and roughly right about here is where fertilization happens. Alright, the uterus, a hollow muscular organ about the shape of a pear that will receive the embryo and sustain it as it develops. The upper 2/3 of the uterus is called the body, and the lower 1/3 is called the cervix. This will partially extend into the upper part of the vagina. And there are 3 layers in the uterus: the endometrium, which is the innermost, because it's endo, the muscular part, the myometrium, and then the perimetrium. The vagina, the fibromuscular tube that will, convey uterine contractions, helps receive the penis for intercourse, and provides the birth canal for the baby to be born. And this is covered by partially enclosed by a thin membrane called the hymen. Alright, the labia, both majora and minora. Majora or major means larger, and minora means smaller by comparison. For the majora, these are the rounded folds of adipose or fat tissues. These will form an elevated area just above the pubic bone called the mons pubis, and that literally means the mountain on the pubis, mons pubis. The smaller folds, the labia minora, these are flattened vertical longitudinal folds between the majora, and these will form the hood-like covering around the clitoris. Of course, the clitoris found between the labia minora. This will correspond to the penis in males. What will remain a clitoris in a female, if the baby is male, will become the penis. So the clitoris and penis have the same origin. As you can imagine, the clitoris very richly supplied with nerve fibers. The vestibule, this is the space between the labia minora that will enclose the openings for the urethra, for urination, and the vagina. And this will secrete mucus into the vestibule during sexual stimulation. So anytime you see vestibule, that is always a reference to some space. So here are all those kind of put together. These layers of fat tissue here and here are the labia majora or labia majus, same thing. And it forms this elevation here, this big mountain or mons pubis. The labia minora here, the vertical thin folds, the clitoris here between the labia minora, and the vestibule will be the space here between the minora. And just like we have with the male, here's a table taken directly from the book that has all the structures we talked about and their main function. Alright, next we'll talk about the female reproductive cycle. Of course, this is characterized by regular recurring changes in the endometrium, the innermost lining of the uterus. That will lead to the actual bleeding each month, and that bleeding is called the menses. Now, when it starts and when it ends will vary on an individual woman. It will start when a woman goes through puberty, so roughly age 13. It could be earlier than that, could be later, and it will continue into the whenever you go through menopause, which could be in your 50s, could be in your 60s, could be in your 40s. This depends. And the very first reproductive cycle is called the menarche. All right. After ovulation, like we just talked about a few minutes ago, on day 14, the hormone progesterone will cause the endometrium to become much more vascular, much more favorable to receiving an embryo in case you do get pregnant. So these high levels of estrogen and progesterone will actually inhibit the secretion of FSH and LH, because you don't want to go through a normal reproductive cycle in case you are pregnant. Because if you are pregnant and these continue at normal levels, you'll have normal uterine contractions and end up losing that fertilized egg. Okay? And after ovulation, the remains of that follicle, that grafting follicle, will quickly break down and become non-functional. Right, as we get further along in the cycle, the levels of estrogen and progesterone will fall fairly sharply. This is what will cause the blood vessels in the endometrial lining to constrict. So remember, the progesterone causes the endometrium to become much more vascular, in case a baby is going to be developing there. So when these levels of estrogen and progesterone drop off, that tissue will start to die. So that constricting of vessels will cut off oxygen, that thickened layer of endometrium, and that tissue will die and start to slough off. So what you're losing each month, what that bleeding is the innermost lining, the endometrial lining. And as a woman gets older, the cycle will become less and less regular, and will finally get to a point where it just stops completely. And when it stops completely, that's menopause. And of course, that will depend greatly on an individual woman, on when it stops. Alright, here's everything kind of put all together with the various hormones here. That large spike of LH causing ovulation on day 14. And it pictures the ovulation here. The various levels of progesterone and estrogen here. And a summary of all the thickening of the endometrium and the sloughing off and the bleeding here. Alright, last thing we'll talk about for this chapter is tubal ligation. This is the corresponding procedure in females as a vasectomy is to males. Whenever you ligate something, you are tying off something. So tubal ligation literally means tying off of the uterine tube or the fallopian tubes. And this will prevent sperm from reaching the egg cell. So the same basic thing here is the vasectomy on the males, cutting off the vas deferens so the sperm can't get from the testes out through the vas deferens and then out. Same thing here, the fallopian tubes are pulled out and then cauterized and cut off so they can't reach each other. But just like when we talked about with the vasectomy, if this isn't cauterized correctly or if this isn't tied off correctly, these ends can grow back together and you still can get pregnant. So this is not 100% of a bet to act as birth control. You still can get pregnant if it's not done correctly. Alright, that takes us to the end of this chapter, the male and female reproductive systems and the menstrual cycle for the female. Of course, if you have any questions, please ask or post them to the discussion board.